And we're back on 2nd Street chatting with BC patient Allison Ducluzeau and the horrible experience she received in BC when it came to healthcare. Allison, we talked about this before the break. The BC government, their healthcare system gave up on you. They said you were going to die in upwards of 2 years. You went to the US, you got the surgery you needed. You look great. You're golfing again. You're running. You mentioned you're back at work and everything. You got your life back. What has been the BC healthcare system's reaction to how you're doing your recovery? The fact that they were clearly wrong.
Oh, they've been extremely defensive. But first off, I just want to say I have an uncle here, and he's been really supportive and has spoken to my surgeon in Baltimore, and he advocates for me. He's supportive for me. He's doing the best he can in a really broken system. So the BC government, in terms of compensating me or reimbursing me even for a part of my costs, it's been an incredibly frustrating experience. And every time I meet with someone, I get gasped. I'm told that my treatment, which, by the way, I am in complete remission now, they tell me it wasn't necessary and they would have chosen a different treatment path, which, we heard about one of their treatment paths, which was made. And, when I question about what would that treatment path have been, well, it's like, oh, well, we would have given you some palliative chemo. For me, that's not right. It's absolutely nonsense. I am living proof of the reason that I got the treatment and that it was the appropriate thing, not only the global standard of care, but also the appropriate treatment for me. There is a surgeon who does this procedure in Vancouver, and she has been an absolute awful experience from the get-go, and she's tried to disparage everyone in my treatment circle, my care circle, and refused to give me a referral for the care that I received. If the government was to prove my BC medical claim for out-of-country care, then I have access to $50,000 of extended medical coverage, but it depends on that. So even if they only paid me $1 from the BC government, I would have access to $50,000 reimbursement. And they're still refusing to. I've even met with the premier of the province about it and, got nowhere. And just this Friday, I learned that that surgeon in Vancouver shared my very personal, incredibly detailed post-operative report that I shared with her when I expected her to give me post-operative care, which she didn't, but she shared it throughout her network across Canada without my permission. And it contains, photographs of my body. I haven't even shared it with my brother. Like, it's that personal.
So, there's so much to unpack to your story. I wish we had another hour to chat about it. Unfortunately, we don't. But what is your message?
I wish I didn't have this story to unpack. Well, I'm contacted at least once a week by somebody who's in a similar crisis with medical care here. And my message to them now is just like, don't screw around, get out of the country. I have a person with the same diagnosis as me who I'm meeting with her and her oncologist tomorrow, but it took them 4 months and she still hadn't had a biopsy care. So she flew to Baltimore and had it 2 weeks ago. And now she's got a treatment plan and a surgery date.
Well, I'm glad that you're helping patients when they're contacting you from all over the country. Toby, just very quickly, we only have a few seconds left, but what's your advice to family members who are having to watch loved ones go through this?
I would say seek out information, seek out knowledge, look for alternative options, and be prepared to pay. I think we need to do better. A lot of people are in the healthcare sector for all the right reasons, but in Allison's case, we had to seek help outside because the system's overburdened and wasn't there for her. And I'm very thankful she's where she is and able to help some other people. We need to do better.
Thank you both for joining me. Allison, it's great to see you're doing so well.
Thank you.